How are colon biopsy samples collected and stored? Have you ever wondered how doctors collect and store colon biopsy samples? It all starts during a colonoscopy. This is a procedure where a flexible tube with a camera, known as a colonoscope, is inserted into the colon. The doctor uses this tool to visually inspect the lining of the colon for any abnormalities, like polyps or suspicious lesions. If they find something that needs further examination, they use specialized instruments that fit through the colonoscope. These instruments, such as biopsy forceps or a wire loop, allow the physician to take small tissue samples from the colon lining. This process is generally quick and is designed to cause minimal discomfort to the patient. Once the biopsy samples are collected, they are immediately placed into a preservative solution, most commonly formalin. This solution helps stabilize the tissue and prevents it from breaking down. Proper fixation is crucial because it preserves the cellular structures, which is necessary for accurate examination later on. After fixation, the samples are labeled and sent to a pathology laboratory. Here, the samples undergo processing, where they are embedded in paraffin, sliced into thin sections, stained, and then examined under a microscope. This microscopic examination helps detect inflammation, precancerous changes, or cancerous cells. Storage of biopsy samples is also very important. After fixation, samples can be kept at room temperature for a limited time before they are processed. Once they are embedded in paraffin blocks, they can be stored long-term at controlled room temperature in pathology archives. For specific tests or research, some samples may be frozen at very low temperatures to preserve DNA, RNA, or proteins. In the context of colon health, these biopsy samples provide vital diagnostic information. They help confirm or rule out cancer, identify the type and stage of tumors, and assist in guiding treatment decisions. The accurate collection and storage of these samples are essential for reliable diagnosis and subsequent patient care. While new non-invasive methods, like liquid biopsies that analyze blood samples, are being developed to detect early colon cancer, traditional tissue biopsies remains the gold standard for definitive diagnosis and histological evaluation. In summary, during a colonoscopy, tissue samples are taken using specialized tools. They are preserved in formalin to fix the tissue and then processed in pathology labs for detailed examination. The samples are stored as paraffin blocks at room temperature or frozen for further studies. Biopsies play a crucial role in confirming diagnoses and guiding treatment options.